Hello. This is actually my first video, so I don't have equipment. I'm just doing this off of my phone. I'm not sure exactly where I'm going to go with this, but I'm doing this basically just kind of as an accountability factor. So I'll just pretend that there's people that care and that people that can hold me accountable. Um, so let me explain where I'm at in my journey. I am getting ready to look at retirement here in the next couple of years. I'm 61 years old. Well, almost 61. Not quite. Why am I saying I'm older than I am? That's not supposed to happen. Um, I know I don't necessarily look that old, but yeah, I am. I'm at a low point in my life because of weight gain. I've been overweight pretty much half of my adult life. But it just feels like especially this last year, even the last few months, I just feel like I've just packed it on more and more. And my self-esteem is pretty much on the low side, I guess you could say. Usually I wear makeup and fix up and all that, but I just really haven't been into it uh, lately. Usually I'll do the eyebrows, and it's already kind of wearing off, and lipstick, if nothing else. Got the gray hair coming in, so I guess I'm just kind of having an identity crisis. With the aging, being an empty nester, not quite sure what my retirement's going to look like, and just dealing with my poor self-image, body image. Um, when women reach this age, society makes us invisible. It's just the way it is. And of course we're not trying to compete with the young beauties, and that's next to impossible anyway. But it's kind of like you get um, shoved in a dusty corner. And I know that there's a lot of women, my age, that are just vibrant and they outgoing and they're reinventing themselves. I mean, not necessarily that I personally know, maybe a couple of them, but just in general, it always feels like, older women are just kind of, excuse me, put on a shelf. And you're just invisible. I'm invisible in society. I know that. I know I don't, especially being overweight, I don't feel attractive. I don't look attractive. So I certainly don't get, the attention from gentlemen that a more attractive woman would get, the way you would get noticed, or just a smile or a nod, that type of thing. And I know I probably have that big shield up that's repelling, you know, any type of attention as well. So I'm just not really in a good place right now. And I am just going to really focus on making changes. So the one thing that is happening for me in my area, I live in the Dallas area, but I did learn about this company, and so it's local, so I'm not selling anything, I'm promoting or anything like that. It's something that I luckily was able to discover, and that I can, you know, try for myself. So that I'll start next week. It involves a food program, it involves working out. Um, I'm already starting what I call hydration therapy, because drinking water, as we all know, is critical. It is crucial. And I'm bad about that. It's like a lot of people. So I've just started really just kind of consciously making an honest effort, because that's also going to be part of this program that I'm going to join. Hydration is really important. Um, so I think I'm just going to document and see how it goes. When I go, they'll do like the measurements and weigh me and all that, and I already know my body fat is probably like 46% or something like that. I know that I'm two people in one. I can remember being, literally half this size, half this weight, and so I know I'm pretty much have the body size of two people. Um, So anyway, that's just kind of where I'm at. Okay, this has already gone into 5 minutes, and I know that anything longer is probably just going to get super boring. So I think I'm just going to post this as it is, and then I'll come back. I have my appointment Monday. Maybe I'll talk about that. I'm just interested if I document this and I can visibly see changes. There's just a lot of things that I want to do. I'm getting my teeth fixed. I have to have implants, recent implants on this. I'm getting the temporary crowns soon, and then the permanent crowns. I've got one tooth down here that's missing. That'll be my next implant. They're very expensive, so it's something that's just gonna have to take some time to do this. I'm extremely self-conscious about that, so even though I have pretty teeth, because of the missing teeth and not, being in the best condition that they should be, which is also another thing I'm going to be working on. I'm very, very self-conscious about my smile. I'm very self-conscious about my weight and how I look. And I don't like that. I don't like the way that I feel. I don't like feeling... I don't even know what the word is. I don't know how to describe it. But, okay, I'm going to stop now because this little thing has a timer, and now we're at 6 minutes and 35 seconds. So I think that's enough. And I'm just going to keep doing this. Even if I'm the only one that's going to benefit from the documentation, that's fine too. But I feel like it will hold me to some accountability to record this. Thank you for anybody who is listening. I appreciate that. Thank you.